it was a revelation in my life when I was younger. And then I realized that sometimes, you know, like your grandmother will say, you just have to drink that tea, you know, and then you're like, what is she talking about? And then you drink the tea and then it works.
Yeah.
And then I found out that drugs, they are extract from plants, you know, like just young and not aware of things. Of course, where do they come from? You know, so it makes sense that nature is already providing a lot. So how is the situation in Aotearoa at the moment with access to I know that there's a big talk with Maori medicine. So can you tell me a little bit of the landscape?
Of course. So much like yourself, for many Maori, we call it rongoa. So rongoa is similar in a sense, I guess, to what would be called homeopathy. Using our resources was a massive part of us being able to achieve and maintain health and well-being. And so that whole concept kind of aligns with our creation stories. So part of our creation stories is Ranginui, the sky father, and Papatūānuku, the earth mother. And so for us, rongoa fits beautifully within that. So I think for a lot of Māori, when we look back in our history, rongoa was a very normal part of life for us. We didn't have access to all these amazing treatments and, you know, different options that we do now. And for us, it was much more natural to turn to our natural environment. But we also had the privilege of growing up learning about that and knowing about that. Whereas in today's environment, you know, not everybody has that upbringing or has been exposed to that way of life. We do have, you know, rongoa practitioners that are available out there. And for me personally, I guess when I'm working with whānau and with patients, you might hear me say whānau a few times tonight. I don't refer typically to patients as patients, they're my whānau. So when we work with whānau, it's about finding out what is important to them and what do they see their health journey looking like, and what are the things that are really core and central to that. So for a lot of people, it is about trying to look at natural alternatives over anything medical. So it's about finding practitioners that can work within that too, particularly because, you know, for some people coming to the doctor is a challenge, but then coming to the doctor and being told, here's your script, and you need all of these, and if that doesn't align with your personal values and beliefs, the chances are that person isn't going to go away and fill that script. So you better just sit there and have a conversation about what is important to you, and okay, these are the things that we might have identified. What is your beliefs around that, and how do we work within those to try and provide care to you in a way that's meaningful, in a way that aligns with what's important to you. Sometimes it is about, you know, people going away and trying natural remedies, trying the things that they want to try first. And sometimes they might come back and say, look, I need further support around this. I might need to start looking at homeopathy or at a rongoa practitioner, because all the tips and tricks that Nan and Koro gave me aren't quite doing the trick this time. I don't know if I'm mixing up my batches correctly. I've had so many whānau come back and they're like, man, my kawakawa cream's not cutting the mustard. I'm like, oh. She's like, I don't know if I picked the right leaves. You know, it was my first time making it. And I love that. I love that people are trying to better their health in a way that feels right for them. But sometimes you will have people come back and say, I tried all the things and for me it hasn't worked, and maybe I might be willing to consider other options. So yeah, I think it's just about meeting people halfway and having a discussion and being really upfront about what is important to them and working within that.